Hello, I'm Dr. Greco. Today we're going to talk about dog allergies. Dog allergies are definitely a very prevalent issue for dogs. They tend to be allergic to a few categories of things. Some dogs can be allergic to a combination of things, just like people. So the big categories are food, stuff in the environment, or fleas. So those are the big ones. So obviously fleas are the easiest one to deal with because you can give them flea preventative and that will make sure we don't get fleas, because dogs with flea allergies, even if a flea jumps on them and is biting them, the saliva is what they're usually allergic to. So definitely you want to make sure that your dog with allergies is on a good flea tick preventative, because that is really the easiest one to make sure of. Food is also a prominent problem with dogs. Dogs tend to be allergic to proteins. Chicken and beef are the top two ones that we see dogs having a problem with. A lot of people worry about grains. There's a lot of grain-free diets on the market. Grain-free is something that I worry about. There have been studies that came out saying that dogs that were fed a grain-free diet could develop heart disease because they're missing an essential amino acid for their heart called taurine. So dogs can be allergic to grains, but it's certainly way less prevalent than being allergic to chicken or beef. If we think your dog has a food allergy, the most common things we're going to see are skin problems. Dogs will, because their skin is inflamed because of allergies, they'll develop rashes, they'll develop bumps, they'll be itchy. Some dogs can have GI upset or loose stools if they have a food allergy as well. So there's definitely things we can do, which is mainly food trials. You want to eliminate that thing that could be causing them to react and have those problems. If they get skin infections, you're going to want to come see me, because often they're going to need some secondary treatment to resolve the skin infection as well. But we'll be talking about addressing the underlying problem, which could be food. So hypoallergenic diets, which are prescription diets, are one option. Those diets are hydrolyzed, and what that means is that the protein is broken down to such a tiny fraction that the immune system cannot recognize it as protein. So your dog theoretically should not react to that if they're food allergic. So that's one option. There are several different prescription hypoallergenic diets on the market, so there's definitely a few options to try. If your dog eats that food and after a few months we're seeing resolution of the symptoms, not recurring with skin infections and itch and redness, then we can either keep the dog on that diet, which tends to be pretty costly, or we can challenge them with single proteins. So there are limited ingredient diets that have one protein. Usually the protein sources are going to be more exotic than chicken and beef. Rabbit, venison, bison, kangaroo, those are all common ones that are available now. An alternative to the dog food in general, like the traditional kibble and canned, is what's called a clean diet. Clean diets are definitely big on the market now with things like Farmer's Dog and Ollie. I do anecdotally, just from having seen so many people transition to those diets, see that those dogs do tend to do better with their skin and their gut health. So I do think that those diets have a really good place there. You can start with those and just see how they do, but I still tell people to try to avoid chicken and beef in those brands. So pork is a good option. That tends to be the least reactive protein in most of the studies that have been done. So that would be a good place to start. If you are doing a food elimination trial, you also want to be very careful with treats. Some people are doing exactly what they need to be doing with the food, but then they're feeding a treat that has chicken fat in it. So you got to be very careful. There are hypoallergenic treats available, or you can just feed some of their food as the treat. But if you check the labels and just make sure that you're not seeing anything like chicken fat, beef, chicken extract, chicken bone meal, anything like that, there are treats on the market that you can get that aren't prescription that will satisfy that as well. Also, vegetables also make good treats too. Obviously, those don't have any protein in them. Okay, and then the last category of allergies is environmental. So this causes a whole spectrum of disease, which we call atopy, which means that they are allergic to stuff in the environment, and the inhaled allergens can cause inflammation and secondary skin changes. So very common for them to have skin and ear infections as well with atopy. And obviously these problems, just like allergies in people, are not something that we can cure. We can manage allergies, but they're gonna still be present. They're not gonna go away. So if they do have seasonal allergies or certain times of the year they're reacting to stuff, the most common symptom people are gonna know is itch. So they come in because they're licking their feet, they're scratching at themselves. That's the precursor to them developing a skin infection, because most dogs, if they are itchy, they're gonna continue to lick at their foot or chew at their foot, and then they're gonna get a secondary infection from the chewing. So that's what typically happens. So my goal usually is trying to intervene with the itch, doing something about that, because I can't necessarily do anything about the inhaled allergy. Most dogs will respond nicely to itch medication. There are a lot of itch medications available on the market. There are injectables. Cytopoint is a big one that definitely helps these dogs manage their itch. If they are really sensitive to stuff, and there are the occasional cases that I do end up referring to dermatologists, because they can make allergy shots for your dog if they allergy test them. So those are more extreme cases, but they do exist. Definitely, if we're not seeing a big change with all the things that we already talked about, making sure we're on flea preventative, changing the diet, treating for itch, then we're going to want to probably talk about those types of things. So dog allergies, very common. I would say probably 1 out of 3 dogs is going to have allergy problems. So if your dog is itchy, if your dog has smelly ears, if your dog has rash and scabs, definitely come see me, because you're probably dealing with an allergy of some type. Thanks.